crisis. Your term is getting closer and everybody becomes anxious. It is so overwhelming that how the delivery will happen. So here we are to decrease some of the anxiety, how the delivery will happen. So first thing, how the delivery happens, there are 4 options. Is it either it is vaginal delivery, assisted vaginal delivery with the vacuum or forceps, or cesarean birth, and even cesarean, after cesarean, normal vaginal delivery is possible. Then vaginal delivery, of course, it is the best method and it is the most natural and it is the most common. Most of the time it comes on its own, but sometimes it doesn't come on its own. Then we do induction. And no need to be scared of the vaginal delivery pain. We are not living in history. It's 2024. There's so many methods to decrease the pain and even to relieve pain. 85%, which is epidural analgesia. But beside that, there's hypnobirthing, water birth, pethidine, and laughing gas. You can discuss these options, or maybe we'll have another setting to discuss all the analgesia options. Then assisted vaginal delivery, or delivering normally vaginally and suddenly somebody may need help because they're unable to push, or there's a fetal distress and we have to expedite and take the baby out, or maybe it's a prolonged labor and crossing all the limits, then we have to deliver the baby. Then assisted vaginal delivery could be with a soft cup which is attached to a strong suction, or it could be metallic forceps. Metallic forceps these days are almost obsolete. Not obsolete, but because vacuum are more friendly, so we most of the time we go option for vacuum. Cesarean section. Nobody is for cesarean section unless there comes some indication or complication which necessitates cesarean. Everybody should be for normal delivery. Then there are 2 types of cesarean section. Elective cesarean, of course, the one which is not done urgently, and the emergency cesarean section because indication necessitates urgent delivery. Then elective cesarean section, like somebody has already 2 previous C-section, of course, or their passage is being obstructed by placenta or something else, or breech is upside down, or baby is bigger size. Emergency C-section, when baby is not happy inside and its cardiotocograph or the heart tracing shows baby is not happy, labor isn't progressing, baby isn't coming down, or there's a bleed, or umbilical cord has just come out. Now people have this question, then we are about to have delivery, what we can do at home. There are things you can do at home. Pre-labor exercises. So do you know the purpose of pre-labor exercises? I will tell you by this. Can you just hold it for a while? So like say suppose this is your baby, this is your pelvis. So ideally this should go inside. Sometimes this pelvis is not that large and baby head is large. So what should, like when you do pre-labor exercise, say suppose a woman is doing cat and cow, cat and cow, cat and cow. So what happens? Your pelvis moves like this, like that. So when you do that, your baby head, which might be bigger than your pelvis, it finds the right diameter and it negotiates, and baby head goes down and you experience dropping and baby experience engagement. So once the baby head is engaged, your labor has only one function, to drop the baby outside. But if it hasn't negotiated already, whatever you do, you will have non-progress of labor and cesarean section. Then these are the exercises, and walking is the best exercise because your pelvis, you might not hear for a second, your pelvis is this bone. So when you walk, so it's not just moves like this, but it moves like this also. You see so many diameters changing, your baby has a better chance to negotiate with the pelvic bone. Then everybody should plan. There should be some plan for relaxation technique in the labor room. So most widely spoken relaxation technique is breathing exercises, and those are smell the roses and blow out all the candles. So when you're smelling the rose, this technique is actually taught in the schools in early years to the children how to relax. So you take 4 seconds in, 7 seconds out, and just try it anytime. It really has relaxation effect. I have tried it many times. It really makes you relax. Yeah, it's somehow related to your pineal gland, and it works that way. Then positive visualization. Hypnobirthing is all about breathing technique and positive visualization. You imagine yourself, you are with your baby and with the healthy baby, and when you start imagining those things, that have effect of decreasing the pain. Then positive affirmations. If you keep on doing some mantras that my body is designed to deliver normal, I can do it, then it works. And this all is about hypnobirthing that use all these three techniques. Then nobody can start labor unless this is the time. Like nature is the best. When nature starts, it starts. Induction can do, but methods at home, they cannot start the labor. But something else they can do, cervical ripening. So when you will start labor pains, if your cervix or your womb mouth, if it's ready, it will have better chance to deliver. So what are those? Red raspberry tea, you can go 4 cups a day. Dates and intercourse, because semen has prostaglandins. Why I didn't say castor oil? Because castor oil may be doing cervical ripening and bringing some contraction, but with the castor oil, some women will have a lot of diarrhea, and they will be dehydrated, and they will be so weak on the day when they're supposed to be really strong. Dates, if somebody has diabetes, they should not try dates a lot. And other methods, evidence is conflicting that they may bring labor pain or they may not, they may do cervical ripening or not, but red raspberry tea, intercourse and dates, they don't have any harm, so there's no harm in trying that. So what are your expectations in delivery room? You'll be in a hospital gown, sorry, same color, and you'll be giving enema. There will be intravenous line most of the time. If you're in active labor, yes, it will be there. And food will be low, yani less. Either you'll be the liquid diet or the soft diet. And there will be CTG, continuous monitoring most of the time. And there will be vaginal exams, which is in the first stage. They're in the latent phase, they are 4 hourly, and in active stage, they are every 2 hours. And after delivery, people may expect episiotomy. Postpartum care, suddenly you become parents and the world is beautiful and everything happy, there's a picture session, and the next day I go to the patient's room and things are changed, things are very different, like parents are tired, and after a few days they come to me and some people are actually crying. It's very common women to cry or be sad. But if you understand it's not you, it's your hormone and whatever the physiology happening in your body, you will be at least prepared, yeah? So postpartum changes, there are changes. Postpartum is a period, 6 weeks, where you are becoming non-pregnant state back, And it could be different for every woman. There, you might be sore few days because you went labor or cesarean, and you will be very tired for several weeks, and longer if somebody has cesarean, and there would be expected bleeding for 6 weeks. Postpartum exhaustion is a chronic exhaustion that feels overwhelming. But good news is it is not universal and it is not inevitable. If you have help, if you have a partner, if you have friends, family who can help you, that may be managed. So first thing, take it easy. One time I just entered patient's room. She was a PhD and she already had a child, and this was second child. She was just lying down, and when I just called her name, she just got up and she said, I am not sure I can raise this baby. And I said, you did it already. I mean, you already have a child. So, like, take it easy. Even with the small deficiencies, you are the perfect mom and you can do it, and women has been doing it all along. Now find a rhythm with your baby, because sleep cycle of the baby could be real different, but if you go along with the same cycle, that will help you to manage yourself. If it's opposite, it's really hard to wake up in the night when you're super fatigued, and then to focus, it could really be hard. Then use your support network. Don't feel shy to ask help and to accept help. And meal train. You can request your family and friends to bring meal train, bring meal for you. And if you have other children, you can plan their child care beforehand. And emotional support. If you feel sad or down, talk to somebody who is a listener, not a judge. You don't need advices what to do. You need a listening ear with compassion, not with judgment. Get proactive about self-care. Just take out time, request break from the baby for a few minutes, take a bath, wear your good dress. These small steps can make you, off from the this chronic clock few minutes, and it will be real relaxing. Find your ideal relaxation routine. This could be just a small stretches, and it could be just a small song which soothes you. I'm not talking about the Netflix series, just the song, yeah. And then emotions. It's a very weird period. I remember mine, like I was really excited on the birth of my child. I was teaching in a university and I was showing everyone my baby, the students. I feel funny now what I was doing. So you're very excited, but you're very exhausted, you're sleepless, and you might be having difficulty in sleeping, difficult concentrating, tired, lack of sleep, and feeling generally well. I want to tell you about the pregnancy brain. Pregnancy brain is not a dumb brain. It's a brain which is more oriented with the needs of safety of the baby and the concerns of the baby. Have you seen birds when they're not with the nest? They're just flying in the rain, they're flying here and there. But somebody who has a nest, she's always busy collecting straws for the nest. So women becomes that nest keeper who's always just concerned about the needs of the baby safety. So pregnancy brain is not evidence proven thing, but actually when you talk to psychiatrists and psychologists, they also don't have idea about that. But after my reading, I just understand this woman is not necessarily dumb, but her focus changes. Her focus is more towards the safety of the baby. So are you enough? People might get this thing, am I enough? Am I perfect mother? Am I the best mother? So trust me, even with all our deficiencies, we have the medal of perfect mother. Then sadness they may take, and sometimes it's really funny. Patients are sitting and in front of me, mom of the patient is sitting, husband sitting, a very happy family in front of me, and suddenly a smiling patient and tears coming out of her eyes. So I just told her, it's not you, it's your hormone. And they find this comfort that it's not me, it's not my personality, it's just my hormones which are working in a weird way. So because there's so much hormonal tsunami happening inside of you, this all may happen. then people may feel like it's very rare. I'm just going step by step to the higher emotions, and it's not universal, it's not inevitable. So some people may feel like give up, feel like hopelessness, low mood, loss of energy, motivation. It's very, very rare, and it may go to a stage where you have to seek help. With our kind of environment, it doesn't happen. It's more of the text thing, honestly. Then baby blues, yeah, it's very common, 4 day, but they ease up less than 2 weeks. You may cry, feel sad or irritable for no reason. So, but if it goes longer period, you must seek help. And we may have a short walk with the baby, and a class for a new mother, yoga, meditation, small trips. And very, very rarely, I haven't seen actually somebody taking medication, even though sometimes some people were really down, but they just bounce up. People are resilient. So support groups are there too. If somebody has traumatic birth experience, if they think, sometimes it's not traumatic birth experience, sometimes it's just feeling that I have a traumatic birth. I have a doctor on the table when she delivered, she said this word, even with the epidural, that I have a traumatic birth experience. I sat with her later on. I said, just tell me what was the traumatic. And she said that I felt the pain, because she wasn't feeling pain all the time during the epidural, but at the end she felt down pain, but it's not traumatic. And even she had a small bone and baby came out with the vacuum. So after this counseling, after a month, she was ready for the next baby. So where was that traumatic birth experience? So most of the time it is not. People perceive that it is traumatic. So newborn care, people can be overwhelmed, that they can be wondering what's happening, and you learn in the initial days, baby crying, feeding, there's sudden gasp and sudden movements and everything. You develop emotional bond with the baby, being physically close, and it's a wondrous experience. And early days, yes, sleep will be disaster. Yeah, husbands are like, now you delivered. Now there has to be a happy ever after. Where it is? I'm sorry. So you have to expect changes and connectivity, no time, your focus from being husband, wife, it is to the parents. So, for some men, it's really difficult. But nowadays, I see when the women is coming, or I am going into the room of the women, it's daddy who's holding the baby, and they're not ready to give to us also. So I think this is not applicable these days. Partners, husband, they participate in the care a lot. So what to do? We have to be patient with each other, talk together, take time to adjust. And women, if you're feeling anything, just speak. Say you're feeling tired, you're feeling like crying, and it's no problem, because it's just your hormone. Yeah. Women has very little interest in the sex, because no time, and the focus is shift. But even you might feel dry, lubricants can help. And when to start, whenever your bleeding stop, and whenever you feel like you can do it, you should do it. But before starting, put a plan of contraception, because once your baby is 21 days old, your fertility may return. You don't want a pregnancy less than a year difference. That would be called, yeah. So breastfeeding, you need plenty of liquids, and you need a good nutrition. Breast engorgement is very common. Actually, Dr. Rania lecture was so wonderful, I don't have to speak anything further. So vaginal and perineal soreness, yeah, there could be pain, there could be discomfort, and if you have a episiotomy, it could be even more painful. And if it's a tear, that would be even more painful. Management, ice and cold pack, 10 to 20 minutes with some thin cloth. You can use gentle squeezes of water should be used, no tissue papers, better. Few inches of the water, that's called sitz bath. You can use 3 times a day or after bowel movement, and do not rinse inside vagina. Shrink the uterus are the contraction. When you are pregnant, your uterus is 500 gram. Once you're not pregnant, it's 50 grams. So you're shrink the uterus contractions, they bring your uterus from 500 gram to 50 gram, and they especially happen when you are breastfeeding. So with the breastfeeding, you will feel these special after pains. They're called shrink the uterus contractions. Also, you can take ibuprofen for that too. Bleeding and discharge, like 2 weeks will be bloody discharge. Later on, it becomes lochia, which is some yellow color. It can come and go for 2 months, and better to avoid tampons for 5 to 6 weeks. Checkup, 2 to 6 weeks is the checkup time. Recovery, especially after cesarean, is a bit longer, and doctor has to check your recovery. They will do exam depending on you have vaginal delivery or the cesarean, and you must discuss your concern during that time. You must list your questions. Always write your question, journal your question, bring the question to the doctor. They must answer your questions. And always discuss birth control. If not at this time, then 6 weeks appointment, or breastfeeding if you have any issues, and if you feel emotionally any thing, at least you express, and doctor can have an idea what is the extent, and they can help you. Call your doctor if you feel these things. If you feel any kind of pain, fever, and signs of infection, heavy bleeding, shortness of breath, and even if you're not sure that this thing has to be discussed with the doctor, it's always better to discuss your concerns with the doctor rather holding anything. Thank you. Any questions? Yeah. Any questions? Would love to answer. I think I was so clear. Yeah. She has question, Huda. Episiotomy. It is stitching. It is stitching outside. And it's not universal. It depends while you're delivering, like how much difficulty is encountered. Depending on that, doctor decides episiotomy. Honestly, in UK, US, they're not giving episiotomy, but they let the tear happen. For us, if we see a bad tear is about to happen and it can go even the anus, your potty passage, it's better to have a clean, neat episiotomy in the right area than your tear just going to the wrong position. So most of the time, but it heals in 3 weeks completely, and it's not that painful. Yeah, any further questions? Okay, I think I'm done. Thank you. Thank you.
Thank you, doctor.
Yeah.
And let's call on Dr. Shahila Amir.